Okay, so PTB is one of the conditions that mostly affect the lungs of the individual, and this really is one of the dangerous condition when it comes to the respiratory tract infections. So today we are going to look at what a PTB looks like. In fact, it is the highly communicable disease that is caused by Mycobacterium tuberculosis. That is the causative organism for pulmonary PTB. And then its acid-fast rod that secretes niacin when reacts when reaches a susceptible site, which is the lungs. So the area of target here is the lungs. So it means that when you inhale the tuberculosis, okay, when you inhale the Mycobacterium tuberculosis, what happens is that its main target is the lungs, especially when it comes to the upper lobes of the lungs, where there is high possibility of what? Of oxygen within these particular lobes within the lungs, and that is why they mostly do well, and that is the target where they mostly what affect the lungs. This is very serious. And then after that, what do? They multiply freely. Okay, whenever they reach the site where they get the oxygen, they multiply freely because they are what? They are aerobic bacteria. They are aerobic what? Bacterium. That is why. Now let's look at the risk factors of pulmonary PTB. When you say talk about risk factors, these are some of the things or the individuals who are mostly at risk for pulmonary PTB. And one of them is child that is younger than 5 years of age. So any child younger than 5 years of age, okay, that person is at risk for pulmonary TB, tuberculosis. And then people who are homeless, lower socioeconomic group, refugee camp or refugee what groups. These people mostly, because they are homeless, they don't have homes, so they mostly gather themselves elsewhere. So the overcrowding is what is causing this particular, or that is posing them what? That danger. It which is very critical in this particular group of people. So, and then we also have drinking unpasteurized milk. And then living in crowded areas, as we spoke about the homeless individuals, and then older clients. Now with these people, because of the immunosuppression, when you grow old, your immune system start to decline, especially when you don't take good care of yourselves. So this one puts you in danger when it comes to the pulmonary PTB. And then when you are affected, it mostly affects you severely. That is why there are people who are also at risk for pulmonary PTB. And then immunosuppressed individuals. When you look at conditions like HIV virus infections, people with this particular condition, their immune system is mostly suppressed, and because of that, they are always at risk for opportunistic infections, and PTB is also one of them. So immunosuppressed individuals are mostly at risk for pulmonary PTB, and then travel to other countries where PTB is also common also puts the individual at risk for this particular condition. Now, in the NCLEX exams, these are one of the important areas that you have to always look out for, especially when they talk about the transmissions. Okay, transmission of this particular condition is through airborne. Okay, though sometimes through contact you can also be affected with what? With contact. But to be specific, we say airborne. Why is it airborne? Because this particular Mycobacterium tuberculosis, which is the organism of PTB, they suspend in the air for a very long time. So whenever someone cough and then you are within an enclosed area, definitely you are likely to be affected, especially if you don't cover yourself, or if you don't cover your face with a face mask, or if you don't have any protective equipment to protect yourself. You are going to be severely affected, or you are going to be exposed to the PTB. This is the reason. So because of that, we say it is an airborne condition. It is easy to get it through the air. Now, let's look at the clinical manifestations of pulmonary PTB. PTB has so many clinical manifestations, and one of them is fatigue. Okay, fatigue, and then lethargy. Lethargy, anorexia is also one of them, and then coughing that lasts up to 3 weeks. So when you are an individual that is having a cough or that has been coughing for more than 3 weeks, please go and do a checkup for pulmonary TB. It might be that you have been exposed and then you are having an active infection. So you have to rule out for this. And then chest tightness or chest pain is going to be present due to what? Due to the effect of this particular Mycobacterium within the lungs, and then the coughing that puts the individual with this particular pain. And then weight loss weight loss is also going to be present, and which is very common in people who are having PTB. Low-grade fever, chills, and then night sweat or diaphoresis are going to be present, especially in the night. The person sleeps and the person will be sweating. This is some of the signs that should indicate to you that the individual is having what? Is having PTB, especially with the coughing and the chest tightness, and then the anorexia, and then sometimes hemoptysis can also be present when you cough in blood, and that one comes at the late part of the symptoms of pulmonary PTB or pulmonary tuberculosis. Let's look at the diagnosis of PTB or the investigations. Now, how do we diagnose PTB? In this particular section, we are going to look at some of the important areas where we need to digest more into it, especially when it comes to the NCLEX exams. We use tuberculin skin test or Mantoux test. Tuberculin skin test or Mantoux test. Now, in this particular test, what do we do? The person, there's going to be an induration. Okay, we are going to inject some chemical agent, okay, under the skin, and the person go home and come back for what? For a reading. Now, what mostly happens is that sometimes it can be positive. It depends on what? On the immune. It depends on what? On the immune system of that particular individual. We'll take time to talk more about the tuberculin skin test. But now, when you do the tuberculin skin test and then it is positive, it indicates to you that that person is actually exposed to pulmonary TB. Mantoux test or tuberculin skin test does not necessarily mean the person has a pulmonary PTB. So take note of this in the NCLEX exams. It has to do with what? An exposure of the individual to the PTB or pulmonary tuberculosis. So when the Mantoux skin test, when the tuberculin skin test or the Mantoux test is positive, what do? We need to confirm it with what? Chest X-ray. Take note of this in NCLEX. So we confirm an active condition, active what? Infection in pulmonary TB with people who are having positive tuberculin test with what? With chest X-ray. Take important notice to that. And then we also have sputum culture. With regards to the gene aspect, all this come under the sputum culture because at the end of the day, the sputum of the individual is going to be taken for culture and sensitivity test. So sputum culture, and take note of this in NCLEX. This is one of the important and most diagnostic tool for pulmonary PTB. We use this one to actually diagnose PTB. Take note of that. It is very, very important whilst you understand it. And then also we can do the quantiferon TB gold test. It can also be done, and then the chest X-ray we also spoke about. Now that we are done with the diagnosis, let's go and look at how we can be able to manage an individual with pulmonary PTB. In fact, this sector has a lot of NCLEX areas or NCLEX targets, okay, as the channel name also demands. So let's look at the management, especially in the hospital. Then we look at the education that is given to the individual whilst going home. All right, so in the hospital, airborne isolation is very, very important. In fact, an airtight room where the ventilation is located behind the building, so that people who are within the facility will not be able to get infected. Why? Because we say it is an airborne. It is an airborne precaution, meaning we get through through the air, especially when the person cough. So we said, airborne isolation is very, very important. It means the person needs a private room with airtight, and then also the individual going to that room is supposed to be protected. That is very important. So it means the nurse should wear a particulate respirator and then also a gown when nursing this particular patient. Okay, a particulate respirator is needed to be able to help the nurse, or prevent the nurse from contracting the pulmonary TB whilst nursing this particular patient. And a gown is also needed. Why the gown? The reason why the gown is also needed is because sometimes the secretion of the patient, or the patient can even touch you, or maybe your clothing can also touch the patient's secretion. In order to avoid this particular thing, we said wear a gown so that whilst leaving the patient room, you can remove this particular gown to be able to help you from this particular infection. And another one is thorough hand washing is very important. And you have the proper way of disposing used tissues, as we speak about. We'll talk about in the later on. So we said that because of this reason, you have to properly wash your hand before and after touching the patient. And also the need for the patient to also wash his or her hands is very, very crucial at this moment. So take note of that. And then take note, another one thing that you should also understand is that in the NCLEX exams, it is very, very paramount in this particular area where if the client wants to leave the room for any laboratory investigation, it can also be that maybe the patient is going for x-ray, for any ultrasound, or for any other diagnostic procedure. Now, because of this, we said let the patient wear a surgical mask, and surgical mask is enough to protect any person around and the nurse and also the laboratory team. This is very important. So take note, when the patient is leaving the room for any diagnostic procedure, he should wear a surgical mask. In the NCLEX exams, you are likely to face something like this when you're solving the question bank. And then also, one of the more important areas also when solving the questions, especially the question bank, is what? Is after 2 to 3 weeks on medication, the risk of transmission is greatly reduced. So when the patient adheres to the medication consecutively for 2 to 3 weeks, we say that the risk of transmission of this particular PTB is greatly reduced. So take note of that. Now that is for the hospital setting, okay, when it comes to the NCLEX exam, and then also for hospital and then individual, purpose. Let's look at the education that we can give to this particular patient who is experiencing pulmonary PTB. We have to instruct the client to follow the medication for treatment. In fact, the treatment regimen is very important. Tell the patient that, okay, he or she is supposed to be taking the medication every day. And then we have to also constantly come to the hospital for checkup, especially every 4 weeks, to see whether the medication is being effective or not. So take note of that. You have to let the patient take the medication consistently. And then you know that the treatment can also last up to 12 months. Why the 12 months is due to the immune system. People who are immunosuppressed, like the HIV individuals and people who are on steroid and those kind of immunosuppressive medication, due to the fact that the immune system that has ability to fight against any infection within the body is being limited. We said that we have to continue taking the medication up to 12 months. And then you know that from 6 to 9 months, if you are healthy individuals, we can be treated. You can be treated. But people who are immunosuppressed, we can extend it to 12 months to be able to help them from the infection. And then adequate nutrition is very important. Balanced diet. Educate the patient on the need for balanced diet. Eat a wealthy diet, high protein diet, and then other calories to be able to help. And then fruit and vegetables are also very needful. And then tell the patient that the family do not need isolation because they already been exposed. They are already been exposed to the PTB because the patient was with the family members at home, so they already during this activity within the home, these family members are already exposed, so there's no need for them to be isolated. In the NCLEX exams, similar thing is likely to happen. So please, when solving the question bank, you have to look out for all these informations. So the family members do not need any isolation. They don't need any isolation. So take note of that. And then tell the patient to cover the mouth when coughing and sneezing. Cover the mouth when coughing and sneezing. And then teach the patient about the need for proper disposal of used tissues, especially into a paper bag. Now, sometimes in solving the question, they can ask you of a polythene bag. They can ask you of a bin. Please take note. It is what? A paper bag. So all used tissues are supposed to be disposed into a paper bag. And then inform the client about the need to do the test every 4 weeks. Why? Every 3 to 4 weeks, you have to come to the hospital to do a checkup to see the effectiveness of the medication, to see whether the medication being effective, thereby causing the mycobacterial tuberculosis down. And then we know that you are fully you are getting ready for treatment. Now, one of the important areas in the NCLEX is that, take note, when the results of 3 consecutive sputum cultures are negative, then we say that the client is considered fully treated. Now, listen, 3 consecutive months negative. So every month the patient is supposed to come for regular checkup in the hospital, and then we do sputum culture to see the amount of bacteria within the system. Now, after this, maybe the 4th month the patient came and he tested negative. It doesn't mean that the patient should discontinue the medication. tell the patient to continue taking the medication for the following month. The patient come again and the results test negative. In the NCLEX exams, please, the patient should still continue taking the medication until we record what? 3 consecutive negative. That shows that the patient is now fully treated. So that ends the what? The pulmonary PTB. And take note of this. Airborne precaution is very, very important. And the need to cover your mouth when sneezing, and then sometimes you can use the elbow to help yourself. And then remember, these people, when you are entering the room, okay, when you are entering the room of an individual with pulmonary PTB, remember to wear a mask, especially N95 mask is also very important. And then the need to what? To also remove gowns before leaving the patient room. And then take note, the mask that you wear is not supposed to be removed within the patient room when you are about to leave. Please leave with the mask before you remove the mask. Why? Because you are already in the patient room. So when you remove the mask, if there's any floating bacteria, you can be infected. All these are areas where NCLEX questions usually come from, especially when solving the question banks. So that brings us to the end of today's lectures on pulmonary PTB. Please kindly subscribe, and then if you need everything about NCLEX, please contact American Dream NCLEX Prayer for all your NCLEX needs. Have a nice day. Bye bye.